you have been very clear. I know that you have known the justice for a long time and obviously are mourning her loss. You've also been very clear about the stakes of her of the nomination of her replacement, particularly about the Affordable Care Act and the fact that the Supreme Court is set to hear arguments that would uproot all of it. What do you want people to know about the background condition under which this election actually is taking place and the Department of Justice's brief in that case?
Well, first, let me just say how sad it is that we lost this wonderful, wonderful giant of the court at this time. Any time she would leave would be a catastrophic loss for our country. But at this time, and I would have hoped that we could have had a few more days to respectfully mourn her passing. I do know that passing on the last minutes before Rosh Hashanah is the special honor of the righteous in the Jewish faith. So that may be why God took her at this time, because she certainly was righteous in any way. The Republicans decided that they would be disrespectful and move ahead that very night by saying that they were going to have a vote on her replacement. Let's remember, this is a lifetime appointment, somebody who could be there for 30 years. It's important to uphold the Constitution of the United States. It should be done with care, whoever the president is. So the hypocrisy of the Republicans on this is really not important in people's daily lives, but it is indicative that they don't keep their word. And this appointment, the reason the president and Leader McConnell are moving forward so quickly is because they want to overturn the Affordable Care Act. And when people understand, and they do, what this means in their lives, no more benefit of the pre-existing condition, no more having your children be on your policy until 26 years old. No more having Medicaid expanded to cover long-term health care and the needs of our children with pre-existing conditions. And returning to a time where being a woman is a pre-existing medical condition. The people know that. And that's why the Republicans are rushing. They want to get it done so they can overturn the Affordable Care Act. And you know what? They're going to be paying this price for elections to come. Elections to come. Everyone's looking at what it makes a difference in these senatorial races. We'll see. But what they don't really understand is they're going to see 2018 again and again and again in terms of their defeats in the Congress. Let
me ask this. I mean, you know, you talk about the sort of electoral consequences and the substantive consequences for people's health care. I mean, again, in the midst of a pandemic, right? Who knows
in the midst of a pandemic,
what long-term lung or heart damage people who've survived COVID have. We're just learning about that. There's a growing sense that the Senate is broken in some ways and that there's a kind of democratic deficit in America. And if Trump's able to appoint this justice after what they did with Merrick Garland, that Democrats have to be thinking in more procedurally radical ways, right? Adding new members to the court, getting rid of the filibuster. Are you thinking along those lines? Do you favor those two policies?
Well, I think that we have to think short-term and long-term. Plenty of time when we win the election, House, Senate, and the White House, which we would today, but the election isn't today. And we can have just a conversation if you want, but we want to have effective political action. We have to not agonize, but organize. And that means that we must show to people right now, and they know for themselves because this is their experience, that this move on the part of Mitch McConnell, and I see you said Mitch America. No, it's Moscow Mitch. It's Moscow Mitch. Let's correct your sign there, or at least understand how others refer to him. And there's a reason for that. But anyway, keeping it on this, the fact is people don't care about what we're doing in Washington. They care about what is happening at their kitchen table in their lives, their health. And by the way, the three most important issues in this election are health care, and health care. At a time when we should be crushing the virus and the president has ignored the science, criminally ignored the science, and instead We have now crossing into 200,000 people who have died. Instead of crushing the virus, they want to crush the Affordable Care Act. This is what we have to focus on right now so that people get out and vote, and they vote early, and they vote in good health, and they vote for their health. Vote your health. Vote your health. And that means the Affordable Care Act, pre-existing conditions, and the rest. They get rid of pre-existing conditions, they have a price to pay for elections to come. They get rid of a woman's right to choose, they have a price to pay for elections to come. So when you're looking at these senators who are in the near term here, that's one thing. But others, you know what? There's, 43 days until the election? It's 44 days until the next election. You know, many of these senators are looking at their next election. And women, people of color in their district, in their states, will remember if they gave them a vote for their health care or if they gave President a vote for his power grab.